Hello future nurses, welcome back to my channel Nurse Profession Bangla. First question, what is the most common MI symptoms? Headache, chest pain, vomiting, fever. Answer, chest pain. The most common symptom of myocardial infarction is severe chest pain, often radiating to the left arm, neck or jaw. It occurs due to reduced blood supply to the heart muscle. Second question, which ECG change in MI? P waves, EQRS, ST elevation, T wave. Answer, ST elevation. ST segment elevation is a classic ECG finding in acute MI. It indicates myocardial injury due to complete blockage of a coronary artery. Third question, what is the normal hemoglobin level? 5 to 8, 8 to 10, 12 to 16, 18 to 20. Answer, 12 to 16. Normal hemoglobin levels are 12 to 16. In adults, hemoglobin carries oxygenated in the blood. Low blood level indicate anemia. Fourth question, insulin given by which route? IV, IM, subcutaneous, oral. Answer, subcutaneous. Insulin is usually administered subcutaneously for slow and steady absorption. Oral route is not used because insulin is destroyed in the GI tract. Question 5. Which is the complication of diabetes? Stroke, neuropathy, retinopathy, all. Answer, all. Diabetes can lead to multiple complications like neuropathy, nerve damage, retinopathy, eye damage, and stroke, vascular problems. Hence, all options are correct. Which is the COPD symptoms? A. Dyspnea, fever, rash, pain. Answer, dyspnea. The main symptoms of COPD is dyspnea, shortness of breath due to airflow limitation and poor gas exchange in the lungs. Seventh, which drug is used to treatment of asthma? Salbutamol, paracetamol, insulin, heparin. Answer, salbutamol. Salbutamol is a bronchodilator that relaxes airway muscles, providing quick relief from bronchospasm in asthma. 8. The disease TB commonly spread by food, air, water, blood. Answer, air. Tuberculosis spread through airborne droplets when an infected person coughs or sneezes, making it highly contagious. 9. What is the normal platelet count? 50 to 1 lakh, 1 lakh to 1.5 lakh, 1.5 to 4 lakh, 5 lakh. Answer, 1.5 to 4 lakh. Normal platelet count is 1.5 to 4 lakh. Platelets are essential for blood clotting. Low levels can cause bleeding. 10. Which test is required for kidney failure? Hemoglobin, creatinine, sugar, cholesterol. Answer, creatinine. Serum creatinine is the most important test to assess kidney function. Increased levels indicate reduced kidney filtration or renal failure. 11. What is glomerular filtration rate? 60, 90, 125, 200. Answer, 125 ml per minute. Normal glomerular filtration rate is about 125 ml per minute in healthy adult. It reflects how well the kidney filter blood. 12. Which is the liver enzyme? ALT, hemoglobin, sodium, potassium. Answer, ALT. Alanine aminotransferase is a liver enzyme. Elevated liver indicate liver cell damage or liver disease. 13. Which substance causes jaundice? Bilirubin, glucose, protein, calcium. Answer, bilirubin. Jaundice occurs due to increased bilirubin level in the blood, leading to yellow discoloration of skin and eye. 14. Which type of shock related to hemorrhage? Septic, hypovolemic, neurogenic, anaphylactic. Answer, hypovolemic shock. Loss of blood in hemorrhage reduced circulating volume, causing hypovolemic shock with low blood pressure and poor perfusion. 15. Which is the first step of CPR? Airway, breathing, circulation, and call help. Answer: call for help. The first step in CPR is to call for help emergency services. Then start CPR, CAB, circulation, airway, breathing. 16. Which is the Burns fluid formula? Parkland formula, BMI, GFR, BMR. Answer: Parkland formula. The Parkland formula is used to calculate fluid replacement in burn patient. 4 ml into body weight into percentage burn area given in first 24 hours. Question 17. Which is the main cause of stroke? Brain blood flow loss, liver disease, kidney failure, lung disease. Answer: brain blood flow loss. Stroke occurs due to interruption of blood supply to the brain, leading to brain cell damage, ischemic or hemorrhagic. Question 18. Which is the nursing care for seizure patient? Restrain, mouth object, side position, give water. Answer: side position. Placing the patient in a side recovery position prevents aspiration and keeps the airway clean during a seizure. 19. What is the normal sodium level in the human body? 120, 135 to 145, 150, 160. Answer: 135 to 145 milliequal per liter. Normal serum sodium level is 135 to 145 milliequal per liter. It helps maintain fluid balance and nerve function. 20. Which is the symptoms of hypokalemia? Weakness, fever, pain, rash. Answer: weakness. Hypokalemia, low potassium, causes muscle weakness, fatigue, and may lead to cardiac arrhythmias. 21. Which is the choice of treatment for angina? Morphine, nitroglycerin, insulin, antibiotic. Answer: nitroglycerin. Nitroglycerin dilates coronary vessels, improving blood flow to the heart and relieving chest pain in angina. 22. Which is the symptoms of congestive heart failure? Edema, rash, fever, pain. Answer: edema. In congestive heart failure, fluid accumulates in tissue causing edema, especially in legs and ankles. 23. ECG P wave represents which problem? Ventricular contraction, atrial depolarization, relaxation, block. Answer: atrial depolarization. The P wave on ECG shows atrial depolarization which leads to atrial contraction. 24. Which is the antidote of heparin? Vitamin K, protamine sulfate, calcium, insulin. Answer: protamine sulfate. Protamine sulfate neutralizes the effect of heparin and is used in case of heparin overdose. Question 25. Which is the antidote of warfarin? Vitamin K, heparin, insulin, atropine. Answer: vitamin K. Vitamin K reverses the anticoagulant effect of warfarin and helps in blood clotting. 26. What is the normal blood sugar level in fasting? 50, 70 to 100, 150 and 200. Answer: 70 to 100 mg per dl. Normal fasting blood glucose level is 70 to 100 mg per dl. Higher value may indicate diabetes. 27. Which is the insulin shock symptoms? Hyperglycemia, sweating, thirst, polyuria. Answer: sweating. Insulin shock hypoglycemia causes symptoms like sweating, tremors, and dizziness due to low blood sugar. Which is the hyperthyroidism symptoms? Weight gain, bradycardia, weight loss, sleep. Answer: weight loss. In hyperthyroidism, increased metabolism leads to weight loss, heat intolerance, and tachycardia. Which is the hypothyroidism symptoms? Weight loss, heat intolerance, weight gain, tachycardia. Answer: weight gain. Hypothyroidism slows metabolism, causing weight gain, cold intolerance, and fatigue. Question 30. Which is the root cause of peptic ulcer? Virus, H. pylori, fungus, TB. Answer: H. pylori. Most peptic ulcers are caused by Helicobacter pylori infection, which damages the stomach lining. Thank you for watching and subscribe Nurse Profession Bangla.